Hi there, my name is Pramit Patel. I'm a GP here at the Wildlife Clinic and I'm also the Chief Medical Officer. Today I'll be talking to you about vasectomies, of which I've done over 2,000 during my 15 years as a GP. So a vasectomy is a minor procedure. It takes 20 to 25 minutes. Now it is a permanent form of contraception and it is the most effective form of contraception when compared to things like female sterilisation, the coil, the implants, oral forms of contraception as well. So I often get asked the question, Doctor, what is a scalpel-free vasectomy? It is what it says on the can. I don't use a scalpel. We've got specially designed instruments that tease open the hole without having to use a scalpel, so no bleeding, no bruising. That's the aim of using this particular no scalpel procedure. So the one thing I would say is that this is not an immediate form of contraception. We always do a sample check between 12 and 16 weeks, and I can talk you through how to do that. However, I always say extra precaution until I can give you all clear. And a word of warning, it takes around about 30 to 40 ejaculations to clear the pipes. You don't need me to tell you what to do. A common question I get asked is this a painful procedure? Well look, apart from the initial sting when we put the local anaesthetic, it's a relatively straightforward, pain-free procedure. You should be able to walk out of the clinic as if nothing's happened. So having a vasectomy does not affect your sex drive, does not affect your performance, and there's no evidence to suggest it's linked to things like prostate cancer or testicular cancer. In actual fact, the evidence says that it improves your sex drive and your libido, so having a vasectomy improves and makes life even better. So, on the day, you'll come, you'll be greeted by our front of house team. I'll make sure you've had a cup of tea, coffee, water, whatever you want, and then I'll bring you into the room. I'll talk through the procedure. I'll just talk you through a little bit about the anatomy. I'll also talk you through what to expect in the 20-25 minutes when you're having the actual procedure done itself. It is a minor operation done under local anaesthetic. I'll then talk you through post-op complications, so what you may expect, not necessarily what you will expect. And then I'll go through the post-op care, what to do after you've left the building. Another really common question I get asked is, what will it look like after I've had the procedure? You will have a really, really small wound. It'll be no more than 1 centimetre. It'll look like a graze. So just imagine you've fallen over and grazed only, nothing more than that. Will it be painful? No. But what I do always advise my patients is to make sure you put a bit of Vaseline on the actual wound itself, because that limits the risk of having an infection, but it also helps with the healing process as well. What happens to me after the procedure? Will I get an infection? Will I have bruising? Well, there's always a small risk of infection, there's always a small risk of bruising. Now, with anything like this, I'd always recommend a nice bag of frozen peas, taking some regular pain relief, and just make sure you rest. So what I always do is I always give you my personal mobile number. So if there's any issues, queries or concerns, feel free to give me a call, night or day, and I'll be as responsive as possible.